Today we're going to talk about IT band syndrome and how to fix your pain if it's coming from the hip or the knee or both. So what we're going to do today is we're going to talk about what IT band syndrome is, what is it that, where does the pain, where do you feel the pain, why people are not being able to treat this condition, what are they doing wrong, and then we're going to go into basically 4 exercises that will help you solve this problem. So let's go into what it is. What it is you have pain from a muscle that comes from the top of the hip to the bone right through here. They call it the TFL. It has a longer name, just think of it as the TFL. That's the muscle part that actually attaches from here to here. Then from this bone on the outside of your hip, all the way down to your knee, and it attaches to the outside part of that knee, there's a band. And that's why they call it IT band. It's a band. And so what often happens is when we feel pain, people can feel pain in their hip. They'll feel it on the outside of their hip. And sometimes when they feel it on the outside of the hip, they'll also have like some pain on the lower part of the leg. You can also feel pain in the knee. On the outside part of that knee, it'll just feel really tight and painful. You can also get it in both locations. So that's typically where you feel it. And where people go wrong with this type of condition is they tend to treat the symptom. Oh, we're going to treat the tightness. We're going to do some soft tissue work in the muscle. We're going to do some soft tissue work down into that band, and you're going to feel really good. The problem is you've got to get into why. Why is the IT band tightening up? What are you doing that's creating that? And that's what we have to get into. So not only is it improving the flexibility and the tightness in this area, but it's also going into why it's happening. So where's there some imbalances in the muscle that is causing us to use this side a little bit more. Common things that we see. A lot of weakness in the back part of the hip, weakness on the inside of the leg. And so what happens is we tend to shift our weight to the outside, which makes us use this IT band as the stabilizing force. So if you have weakness in the hip, then you're going to get that IT band on the outside to help stabilize it. And because it crosses 2 joints, hip joint and knee joint, you could feel it in both locations or one location, wherever the tightness is happening. So we've got to adjust what that looks like. So what we're going to do today is we're going to show you 4 exercises that some of it's going to be a stretch that we're going to show you, and others are going to be some strengthening to address the weakness that we see back through here as well as in through that adductor. So those are the things that we're going to actually show you today. So the first stretch is we're going to use a strap, and I really like this one. I'm going to show you the wrong way to do it, and I'm going to show you the correct way to do it and why. So you're going to put the strap on your foot. So if this is the leg that we want to stretch out, the key to this stretch is you want to keep the knee straight, because if the knee bends a little bit, what's going to happen is you're not going to feel it and where you need to feel it. Because it crosses 2 joints, we've got to keep that knee straight. Otherwise, you're not going to feel it where we need to feel it. So you're going to take it and you're going to bring it all the way across and around. Now, again, if the knee's bent, the IT band crosses the hip and it crosses the knee. So sometimes, because it's so tight, you have to actually push that knee out. So a couple ways to push it back. So you're going to push it back. There's a couple ways to make it harder. You can make it harder by dropping the leg lower to do it. You can make it harder by bringing the leg up. You can do a combination of both, but make sure you keep that knee straight, and you almost have to put pressure through it, and you'll actually feel it. You can almost feel it down even into the calf, because that's kind of the referral pattern that you'll see with this type of muscle. Now, some people will come up and will go across, won't get the same effect. You have to literally bring it around and come across, holding that knee so that you can kind of hold this position. And you want to hold it for a good minute or so, breathing, relaxing into it. You're going to feel it. It's not going to, this is not this feels like such a good stretch. It could be a little painful, so you kind of have to gauge that, but you have to be able to breathe and hold it. If you can't hold it, then you're pushing too hard, back off a little bit, because you can continue to do this stretch and make it better and better and better. And when things become more flexible, then you're going to notice that you're not going to have as much knee pain. Now, this is really good to just continue to do. It's one of my favorite stretches that I love to do. It can take pain away. that's just kind of that constant dull achy pain on the outside of that knee. That'll definitely help with this stretch. But how to solve this from not using this muscle, this IT band as a main stabilizer, is we've also got to work on some strengthening exercises. So we're going to go into 3 exercises that will help specifically in different parts of the body. The first one's going to be that hamstring hip extensor a little bit, and we're going to use a towel for this exercise. Another one that we're going to do is going to get a little bit that lower part of the glute, and then the last one we're going to use is going to be that adductor. So let's go into the first one. We're going to do bridging. So what you're going to want to do is you have something, because we want to actually dig our heel in and bend it towards our body to really get that hamstring involved. So what you'll do is you'll lift up to get the hamstring involved, and you want to dig the heel and slide it back. And then you can kind of come down, go back up, lift up, dig that heel and slide it back. So you can really get that hamstring involved. You're going to want to do this about 15, 20 times. You can definitely make it harder by digging both heels into the towel to pull those legs in. That's much harder. If you are on carpet or something like that, you can use a furniture slider. That'll work. You can also use a paper plate. So there's a lot of different ways to do it. Just find something that's going to slide on whatever surface that you need. Doing those exercises about, it's like I said, 15, 20 times. The next one we're going to show you, we're going to need something that's going to elevate or help me. We're going to use this for a couple of things. So next one we want to use, same kind of thing. I'm going to show you on this side, just so I'm facing the camera. But you're going to be with your feet. You can use a book for this, and then your feet are just going to go up something that's not going to move. I'm just using this for now because I'm going to use this step for the next exercise. So you want to make sure that you're 90 degrees, so you don't want to be way out here. It's not going to work as well. You want to come in a little bit more. Really like this exercise. You can also make it harder by putting a band around your knees. But a lot of times I usually have to have people when we first start this to actually hold the exercise, because they won't feel anything and then they'll feel a slow burn because they're not used to activating these muscles, which is part of the problem, because these muscles on the lower part of that glute on the outside don't fire. So what's firing is you're using that IT band stability on the outside, which is why you're creating a lot of issues. So what you'll do is you're going to tuck just a little bit, like put that back pocket and tuck it down a little bit. It doesn't have to be a forceful tuck. You're just tucking just a little bit. Then you're going to push the heel into the table. This is going to get those hip extensors firing, especially when you get that little bit of tuck. Then you're going to take the knee and you're going to drive it forward a little bit and then lift up. And you're going to hold that. Hold it till you feel a slow burn. You'll be like, oh yeah, I can feel that in my hip. It's going to be very slight at first because you're just trying to get these muscles to start firing. They don't fire very well, which is part of the problem. So again, you're going to tuck, you're going to push the top heel into the wall, the knee comes forward, and then you elevate the knee up. Make sure that foot doesn't roll up like this. You want to make sure the foot's pretty flat on the ground as you lift up. You're going to hold it. Hold it till you feel a good burn. When you feel that burn, it may be 5 seconds, 10 seconds. Eventually you'll start noticing that things will start firing and it'll be a little bit easier. So you're gonna, again, those exercises are really good to do. If you're gonna hold it about 10 seconds or so, I'd say like do 10 of them. And these are gonna be good to do a couple times a day to really get things firing. So that is the third exercise. And then the last one, we wanna get the adductors firing. And again, so the one that we're gonna work on is, we'll work on this one just so I can face the camera. So whichever leg is giving you the problems is the leg that you want on top of this. So what you'll do is you're going to bend the knee on the bottom. This leg's going to be up on a surface, and you're going to push down to lift your hips. I'm going to push down and lift my hips. So I can use this side to kind of help a little bit, but then you can come up and bring the knee up and then bring the knee down to really get those adductors firing. Really good one. These typically are fairly weak. It's a great one to kind of start working on. Again, lift your hips up, push, bring the knee up. Now you can keep the knee up and hold it longer. That's a way you can progress, come down, and then come back down. And so this is a great exercise for the inside of the leg. So if these are things that you're enjoying our content, make sure you subscribe to our channel because we provide content all the time. Our goal is to provide education to help you make a better educated decision on like which direction you need to go. Always reach out if you have any questions or anything like that. My name is Stephanie. I'm with Empower Physical Therapy, and we help clients avoid surgeries, injections, and medications while getting your life back. We often see people that have tried 5, 6, 7, 8, 9 different types of healthcare providers before finding us, where we're actually able to help them put the pieces of the puzzle together and really critically think through kind of what's going on. So make sure you subscribe. There's more videos that are also in the description. So if you're wanting to learn more about the hip and the knee, definitely make sure you look in our description, as we have a lot of other resources there for you.